Telemedicine.
15
What
minutes or
is
so.
it? Can you take a picture of your dong and send it to people?
But actually,
Can you do that? Can you send naked pictures of yourself? Because you can't generally.
This is the one time actually a dick pic is okay.
God, I don't know if that's ever okay.
Well, granted, it's between
for medicinal purposes only.
A confidential patient-physician relationship. There are times
is
as
it
a urologist.
Confidential?
Well, sure.
Do you send a pic of your business?
Well,
to your doctor?
More, it's a live video look. I mean, there's been times I've seen a guy via telemedicine.
Why do you do this job?
Balls Deep.
Welcome to Balls Deep, a humorous yet informative medical show with a mission of optimizing your performance in the bedroom, the bathroom, and the boardroom. I'm your host, Dr. Joe Pizzona, a board-certified urologist and CEO of Pizzona MD. We hope you enjoy. Now, let's jump right in. Well, welcome back. Here we are, another episode of Balls Deep. Kat, you holding on?
I'm holding on. Yes, I'm making it.
Episode 3 of 3 in our batch. I mean, we're even too late. We don't even bother with wardrobe changes. We just
No. I had some Halloween candy in the car, so it's fading. It's fading.
We'll make this one maybe a little.
I had 2 Kit Kats, but it wasn't enough.
We'll go a little shorter and sweeter
We'll just hit it hard. Get in, get out.
You shouldn't say that to a urologist. I'm
Sorry.
biting my tongue. I will just
Didn't even
let
occur
the
to me.
imagination go.
Just start. What are we talking about today? I'm the one with the paper. I know what we're talking about today. We're going to talk about telemedicine.
Yes. This is something I really have enjoyed for several years. You know, even before pandemic, just saw why is it that there's all these barriers to me helping people? And there's so much of what I do, which is just talking and giving my wisdom and advice. And so I thought it was appropriate to bring this up as we've introduced our new care model, and telemedicine is going to play a big role in that. But just to hopefully, again, spark more of an interest amongst people, because I think there's a lot of negative thoughts about telemedicine, both from patients and physicians. But hopefully at the end, people will feel that there's some real benefits to it.
Okay, so let's start at the beginning. What is telemedicine?
Well, I guess we should just dive right in first.
Oh, we can do that.
You forgot our segments.
Sorry.
She doesn't pay attention. Like, the production is just not good.
Balls Deep.
Yes. So what is telemedicine? So telemedicine essentially is the delivery of healthcare via some sort of audio-visual technology. Now,
where you don't have to go in person and make a trip to the office to talk to your doctor.
Now, there are different ways to, quote, do telemedicine. So for those who have ever tried those, they're basically digital pharmacies, right? The commercials where you get your little blue pill and just have a telemedicine visit and we'll get you some little blue pill. They can, depending upon the state, it may be as simple as even just like a text interaction. But
oh, really?
In general, it typically has to be a HIPAA compliant, meaning it's got to meet all the privacy criteria, audio-visual visit between a doctor and a patient. Okay, so that means that we've got to see each other's face somehow, and we can hear each other as well. This does not mean a phone call can count. This does not mean text messaging in some cases. And a lot of these rules exist, shocker, because of insurance, right? So they don't want to pay
insurance again.
They don't want to pay us for talking to patients on the phone, even though what we're telling them may be just as valuable as if you got dressed, put on your makeup, got in your car, found a sitter, drove, found some parking, sat in traffic. Now you're in my waiting room. We're running a little bit late. Now you're brought back. Hey, I'm in front of you now. What's your question?
It could just have been on the phone.
It could have been. So telemedicine is removing all of those processes to simply get that physician and the patient together virtually.
Okay. What is telemedicine not?
So,
trick question.
Yeah. I mean, I think it's, technically speaking, what I just alluded to. It's not, telemedicine technically is not a phone call. It's not a text message with your doctor. There's a variety of interactions we have as physicians with our patients. Now, when it comes to someone we've never met before, like we're establishing a new relationship. I've never met you. I have no idea until you start talking to me or I've looked at your forms why you're coming to see me. Traditionally, most of those visits are going to be a face-to-face, but they could be a telemedicine visit where, again, I can see you on a video screen and I can obtain a history from you, because a traditional healthcare evaluation requires a history. I got to hear and listen to what's going on with you. Some degree of a physical exam. Now, a physical exam could simply just be looking at you.
Could be visual.
You're well-nourished, you're alert, you're cooperative, you're able to speak in full sentences. I can
Sometimes.
see that you're breathing appropriately and you're not huffing and puffing. You don't have any signs of wasting, which could be a sign of cancer. I can see your eyes are symmetric. There's a lot of things I can do just by looking at you as a physician to know, oh, okay, this person's reasonably healthy in front of me versus someone who's not. And then the last part of that evaluation is me doing an assessment and discussing a plan of care with you. And so putting that all together, a lot of that can be done virtually through telemedicine.
Okay, so seems like there are a lot of benefits to telemedicine. Why don't you hit us with a few benefits, and then we'll talk about a couple of downsides. When telemedicine may be appropriate and could be a great option, and on the cases when it might not be the best option.
Think about all the steps and the investment of time and money from the moment you decide to leave your house to you're now sitting face to face in the same room with your doctor. I alluded to them earlier, right? You may have to arrange care for a loved one.
You may have to leave work.
Leave work.
Take time off.
You have to drive, fight traffic, find parking, sit in a waiting room, check in with the front desk, check your insurance eligibility, all that sort of stuff, right? With a telemedicine visit, you could simply, while at work, go pop in an empty conference room, click on the link we sent you, and now you're having a secure face-to-face visit with that physician in a matter of seconds.
Easier.
A lot easier.
A lot easier.
So I think that's the obvious benefit is it removes so much of that friction from I've got to leave wherever I am now to get in person with you and all the pain that's associated with that.
Right.
The second thing, which is really interesting, and I've talked to many colleagues about this, and it's anecdotal. I don't have any data to back it up, but it is 100% true. That in the large majority of cases, I find that the telemedicine visits are much more focused and efficient and sometimes more effective. If you think about, from a patient's perspective, all the pain and frustration you just went through to get in front of the doctor, and then as the doctor, all the pain and frustration I'm going through in a clinic. Hey, Dr. P, can I ask you this question? Got to go run to the bathroom. Oh, this person's not ready yet. I got to go do a procedure. This guy's running late. His forms are not ready. Whereas if I just have a day of telemedicine visits, it's click. Hey, how you doing? Conversation. I'm typing while we're chatting. I'm looking at you. Visit over. Click. Drink water. Go up to go to the bathroom. Come sit back down. Oh, next visit. Click. It's so much more efficient. And we seem to be in this mindset, especially post-COVID, where it's just like, let's just get in and get out. Like, I don't want to sit here in front of my phone or computer for like endless hours. I don't have any distractions, right? Like you're not sitting there playing on your phone, reading a book, doing other things. It is just dead on. I'm looking this human being in the eyes and we're just getting through this visit. So I find the visits are much more focused.
That's a very good thing.
Absolutely.
Okay.
I mean, listen, time is precious.
For all of us.
Yep.
Absolutely. Downsides of telemedicine.
This is probably not best if you have a lump, a bump, a subtle rash, something that requires a real close look at or my hands to touch. Okay.
Okay.
Now, again, I'm sure Chad will throw it into the beginning of the video here, our conversation about dick pics and other things. But yeah, I mean, I was talking to a doctor the other day who does robotic surgery. He's like, honestly, I just need to know whether they have scars on their belly, which is a sign of previous surgeries. Because if you've had a previous abdominal surgery, that means my surgery might be more difficult. So he asks guys to just lift up their shirt and looks for scars. I mean, so you can still do a physical exam. It's just much more limited. So if it's something I've got to touch or feel, see if you're tender, probably not the best thing. Depending upon the degree of trust and the severity of what's going on, There is some degree a human element that's lost when I can't shake your hand, when I've just dropped some terrible news on you and you kind of need a hug at the end of that visit, someone to hand you a box of tissues. It's a little bit harder sometimes via telemedicine, but you could also argue someone getting that news in the comfort of their home with all their loved ones in the room, there's a comfort there. So it's a little bit of a give and take.
And that may be personal preference.
Absolutely. There's an IT issue for some people. God, even in in the heart of Nashville, it's amazing how often internet goes out, right?
Well, listen, the boxing match last Friday,
Yeah.
the Tyson Paul thing, apparently Netflix blew it with the buffering on that.
Yeah.
So,
So
IT
IT's a real
stuff
thing.
happens.
But for the most part, it works pretty darn well. But certainly there are some glitches, and sometimes an older population has a little bit trouble with checking their email, clicking the link, all that stuff.
Fair enough.
And then probably the main downside and why it's not being utilized more is, again, good old insurance and billing. So during the pandemic, they suspended all the rules and regulations around telemedicine, essentially said, listen, you got no options. You got to get in front of your doctor. We'll pay you the same rate for a telemedicine visit as we will an in-person. Well,
But that has changed.
the second that settled down, it changed. And oh, by the way, it's not just a simple rule across all insurance companies, right? Everyone's got their own unique. So for a lot of doctors' offices, again, we talked about complexity in previous episodes. Now imagine adding a complexity to figuring out how you're going to get paid for telemedicine visits. They're just like,
Yikes.
forget that. Come and see me in my office. That's the only way I'm going to see you.
But in a direct care model, talk about telemedicine.
Well, that's a beautiful.
Seems super easy.
That's a beautiful thing of it. If we have already worked out, say, a monthly membership and you're getting access and all you need is a text message or a phone call, or you want me to see something on video, great, dial. Let's go. I'm free.
How simple is that?
Yeah. So I think it's a great tool in that model. And even leading up to it, that's where we've really utilized it. We have done a lot of wellness management. We have done hormone optimization, a lot of things in our practice that have been more on the wellness side. And of course, insurance doesn't cover wellness. They don't care if you want to feel better. They just only treat you if you're sick. So we have found it to be incredibly effective and people are really happy. I mean, if you're a 47-year-old guy or a busy mom with 3 kids running around, you don't want to have to go drive into a doctor's office. Just dial me up. Tell me how my labs looked. I've got a couple questions I'm hoping to get answered, and we're good. And that's how healthcare should be. So when people say, telemedicine is broken, it doesn't work. Telemedicine is a tool, and it is only as good as the use cases and the situations in which it is being deployed. So there's nothing wrong inherently with telemedicine. What's wrong is when insurance companies don't reimburse you for it, or you don't utilize it properly to better leverage your time, because there are only so many doctors in this country.
Right.
We are all distracted and button clicking and of all these other stupid things that are asked of us. We have to get more highly leveraged with our time. And I really believe telemedicine's that key. And I think it also, another benefit I didn't allude to earlier, it can break down the geographic barriers. So
that's something.
Think about it. If you're 3 hours away, but you believe I'm the best doctor or medical practice to solve your problem, why can't we just talk about it on some sort of phone or video chat?
Right.
What if we're across state lines? And so there's a lot of practices where we're getting medical licenses in multiple states and go, well, listen, just because you don't live in Nashville doesn't mean you don't have access to Pizona MD. I mean, right now I've got about 8 different medical licenses in various states across the country, so I can help these rural areas out. And so I'm really, really excited about telemedicine. I don't think it died during the pandemic. I think what happened during the pandemic was you had a couple big players who jumped on the opportunity for cash. They jumped in bed with insurance companies. And then the second people had a way to go back to the good old way, and that medical offices saw that that they couldn't get paid for it, it has gone away. But that doesn't mean telemedicine is not an effective tool in a large majority of cases.
Well, I think it sounds pretty good. In fact, I would love the opportunity to eliminate driving to particular appointments and just talking to people over the phone or over a video chat.
If we can only figure
I'm
out
in.
if we can only figure a way to get you the Botox and the lasers virtually, I mean, you're in.
Yeah, I mean, that's a whole different story. But if we could, that'd be great. Though we don't want me to start trying to administer that to myself.
No, I don't.
Disaster.
No, I don't
Disaster.
think so. No, I'm not.
I'm not that crazy.
I'm not touching your face that way either.
No,
so.
no, God, no. Okay.
Well, anything else, Kat?
I think that's it.
All right. Well,
anything you want to say?
No, again, short and sweet. I wanted people to leave this episode going, let me see if my doctor can do telemedicine. I mean, there's really no reason, again, outside of insurance company and stubborn practices, why it's not being more widely adopted. So at Pizzona MD, we love it. Our patients love it. And listen, if you need to come in and get checked out, we are here. But stop saying telemedicine is bad healthcare or not as good. I'm sorry. It's the healthcare that's bad. It's not the technology. If I'm sitting there and all we're doing is talking about why you're getting UTIs and what I can do to help you prevent them and a workup, you don't need to come in if you're an otherwise young, healthy person. If you're a guy with erectile dysfunction and Viagra's not working, I don't need you to come into my office for me to touch your private area or do anything for me to know how to counsel you and go through these steps. So it's not for everything, but there's a large portion of healthcare we can do. So we just got to get out of this stubborn mindset and keep thinking, oh, you got to come drive to my office. And no, let's start making healthcare easier. And I think telemedicine is a great way to do that.
I like it. Yeah. I'm in.
Awesome. Well, let's for the second episode in a row, go to your favorite segment, Unprepared.
Just the tip. Gosh, it's really, I'm so not prepared for any of this.
Kat,
okay.
You know it's coming. Every single time.
It's been a rough morning this morning.
Struggle bus, all fairness.
Struggle bus. Number one tip of the day, telemedicine. Definitely a great tool. It's out there. It's not for everything, but it can be. You can talk about a lot over a phone call, over a video chat. It's to quote Martha Stewart, it's a good thing.
Yeah.
Telemedicine, not for everything. There's certainly going to be conditions where you do need to go in person and talk with your physician. Could be a moment when your physician does need to put their hands on you to appropriately diagnose what's occurring. So it's for many things, but not for everything. Mm-hmm. And number three, it should be more widely adopted. We need to think forward, think futuristically, and move on from the old stuck mindsets of everything to handle your healthcare journey has to happen after you've made the journey across town, through the traffic, away from work, away from your children, to sit in a room across from your physician. Doesn't always have to be like that. It's a great alternative.
It's a quaint, sweet, wonderful idea to think that you can just stroll down the street, walk into your doctor's office, the same doctor you've seen for 20, 30 years. Mm. He or she sits down with you very quickly, spends as much time as you need, face to face. You chat about your families, you get your health care, and then you leave.
Okay, Norman Rockwell, that's not happening.
And we should strive for some version of that. But that's not reality. And in healthcare, we have to start looking at the best alternative solutions because of all the complexities. People's health is more complex. We have more drugs available to treat illnesses now than I can count. Half the drugs on the market I've never heard of, and I've only been doing this for 16 years. So we need super specialists because of how complex it is and how amazing some of these care deliveries are, whether it's a medication or surgery. Insurance companies are becoming more and more complex. They make it so we're spending more time not taking care of our patients. And then lastly, people, PSA, doctors are burning out and leaving healthcare. There's not enough of us to go around. So if you're still stuck on this idea that every single specialty is going to move to your town and set up a shingle for the next 30 years and never leave and spend as much time with you as possible,
This probably won't happen.
it would be wonderful. It's just not going to happen. So what are some best alternative solutions? I think telemedicine is a great tool to help more people, improve access, and decrease the friction and the complexity of getting people some help in the appropriate situations.
I think that said it all.
Well, hey, every now and then I'm a little clear and concise. So
He's pretty smart.
she always tells me to just quiet it down and not talk so much. But again, I'm an Italian from New York. I'm going to keep using my hands. I'm going to talk a lot. So again, this isn't the most polished healthcare podcast, but you don't want that.
But it's fun.
It is fun and hopefully useful. So,
All right, wrap it up.
Stream team, thank you so much. We are so excited you're still sticking with us. I think we've done over 25 episodes now, so
Great.
we're going to keep going. Please leave some comments. Subscribe to us on YouTube, again, just to see Catherine's clothing options, amongst other things, her medical conditions, her facial expressions. Why not? And until next time, please show yourself a little bit more love and kindness. We're all works in progress, and these are opportunities to grow. Take care and have a great day.
Thank you for listening to this week's episode of Balls Deep. If you'd like to join our stream team of listeners, please click the subscribe button on your favorite podcast platform. For more information about our practice, Pizona MD, please visit pizonamd.com. This podcast is for informational purposes only, and the content is not intended to be a substitute for professional medical advice. The show does not constitute the practice of medicine. No doctor-patient relationship is formed through this podcast or any of the social media channels related to this show. The use of this information is at the user's own risk. Users should not disregard or delay in obtaining medical advice from any medical condition they have, and they should seek the assistance of their healthcare professionals for any such conditions.